Let me give a suggestion with language disparities. Sometimes you may have patients who only speak Spanish, depending on where you're at. I've got several clients in the South, and they deal with a lot more patients who only speak Spanish. Or it may be another situation. But what I would do with that, obviously it helps if you have a staff member who can speak that language. But I tell you here's what else I would do with that. Now, we already know the main points relative to the consultation, right? We already know what's a higher priority, lower priority, all that. And we know the patient education. So this is what I would do. And remember, you also have these devices now, the voice translators that are just fantastic. So I would do a couple things, but here's what I would do. I would record. I would have in recording the major key points that you deal with patients over and over, especially like starting with patient education. If I didn't speak Spanish, I would have a Spanish employee, or I'd hire somebody Spanish, and I'd have them record the patient education in Spanish. That's what I'd do. Now, I'd also do a lot with the consultation. I'd have them do the Spanish part and some of the major parts of the consultation. Whether they're having, especially with the type of problem, the diagnosis, whether they're having nerve pressure, disc pressure, joint pressure, I'd have this all in Spanish. So you can just literally hit the button or play it, it's on your computer or whatever. And there you are. All the major components. Obviously, you can't do that for everybody because you got to have a personal relationship. But chief complaints, I'm going to ask that in Spanish. I'm going to have it documented in Spanish, have them check the list and get to where I can convert it to English and I can read it or see it. The chief complaint, OPP Cresti, that'll be just done in Spanish. I'm just going to see where it's converted. Same with ADLs. I mean, I'm just going to have it done in Spanish. It's going to be recording, audio, the patient education I would do in video. The consultation you can do in audio, and then just make sure you can transfer it, because it's real easy to transfer with the devices now. And some of the electronic health records are starting to even include where you can transfer it. But now you can have the devices. So you literally can do like 80, 90% of the whole communication in that other language if you're using the device or the audio. I would be using these other tools significantly. And then what I want to pay attention to is the human part. So what are the parts that I really need to nail down? Well, I need to make sure I shake the person's hand. That's bonding and rapport, right? I need to make sure I touch the chief complaint. That's bonding rapport. Make sure I do a good physical exam. That helps with bonding. That's not a language issue, okay? And I can have on the recording to tell the patient, in that language, I'm going to do your exam, and you say whatever the language is for positive or negative or yes or no. So that's the exam. I'll get his answers for that. The diagnosis, I just have several diagnoses in audio, and I press the one that applies to that particular patient so they're clear. And same with x-rays. I'd have that in Latin also, say the reason we need x-rays, and what we would need to do is take x-rays, and this is why. I'd have all that in the other language. That's what I would do. And then have it piecemeal, where you can just hit the button and play whichever one, and that applies to where you're at. So that's the x-rays. And then what happens to come back? What are the steps that's going to happen between at the end of day one? Remember, there's about 5 steps that you need to tell them. We're going to take x-rays, and then we're going to do therapy, and then you're going to make your appointment at the front, use the ice pack tonight, and then we'll see you tomorrow, and I'll work with you more tomorrow, depending on what the x-rays show. That's all going to be in Spanish. I'm just going to hit the button. So there's real clarity when I get to that point. I'm just going to have all of these things separated out. So on my computer, on my laptop, right on the desk. So I just have to hit it, and there's the language right there. That's what I would do to significantly increase the effectiveness of communicating. And then I'm just hitting the majors. That's all. The touch, the tell, the confirmation, That's all. And even when it talks it in Spanish, the patient can go, see, okay, done. See, we've connected. I didn't have to speak Spanish. But that's what I would do. I would not be fighting with not using these tools, because these tools are so good now. The translator tool. And for patient education, I would just do, I'd even, if my staff member speaks Spanish, I would just have her do it and video record it. Day 1, day 2, day 3, day 4. There you go. It's not going to be as personal, but you get the point across. And then you emphasize, what it is you're talking about with that, their chief complaint, their ADL. But as far as the content, I would have a video of the Spanish person doing each of the sections of the patient education. That's what I would do. Make it a hell of a lot easier and way more effective and a better communicator than struggling and fighting and piecemealing it and blah, blah, blah. I'd do day 1 that way. I'd do day 2 that way. I'd do day 3 and day 4 that way. And they would be in piecemeals, and they would be like named. You'd have all these audio sections or even the video, and then it would be named, the x-ray section. Like day 1, there'd be all the different audio sections. Day 2, the different audio sections. And they would be named. And then I just hit it. He goes, oh, yeah, we're going to need x-rays. However you say it in Spanish, we're going to need x-rays. What we'll do is take x-rays, blah, 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 whatever the sequence is. Hopefully you get the point of what I'm talking about. I'd be using these audio tools, recording tools, video tools. That would be like 90% of my communication. And I'm just confirming, I'd be going, most of mine would be see, I'd just be okaying it with the patient, see, or whatever yes is, or I would just know basic words like pain, yes, no, pain, and just to confirm. And then I'm having my tools go through the whole consultation, patient education. There you go.